It's a difficult topic for me to discuss. Naturally, we think that art therapy is something that art therapy is just about drawing and nothing else. And that's what the clients think, frivolously and flippantly relating themselves to art therapy. But I would like to show how art therapy helps using the example of grief, loss, and how art therapy helps in these subject matters, how powerful it is. The story of the war, the story of our environment, and the story of our life, day-to-day life, is the story of loss, the story of grief, the story of suffering. And it's been 3 years, it's coming on 3 years that we are fighting for our freedom and sovereignty. And thanks to arts, thanks to our professional community and containment, we are able to withstand a lot of issues. Our therapeutics community is continuing its support, and I can't help but wonder and amaze myself, admire the resiliency of everyone. War has a lot of powerful emotions, a lot of losses, difficult, acute, and during the conflict, the person is experiencing them even more poignantly. Ms. Maria discusses grief as the universal experience of all people, the experience of loss of one's own identity, of one's expectations for the future, that is accompanied by heartfelt pain, sadness, helplessness, powerlessness. When we think about loss, this is something irreversible, something valuable that has left us, and we are left with trying to cope and manage. The loss leads to grief. In this process, the person, without realizing it, is performing inscape work. Some people allow us as therapists into this, into their inscape, but it is paramount to not be alone in such situations. Our grief is accompanied by a gamut of experiences and feelings, be it anger, fear, guilt, shame, love, frustration, resentment, jealousy. So everything is mixed up, and our therapy is the one that helps to discern different emotions, name them, and see them. We are the ones who are taking care of this profession, working with our own emotions and feelings and those of our clients. We need to face sometimes complex grief. The war brings to us the grief based on the uncertain death. I will talk about complex grief that is attendant with the situations when you cannot say goodbye, when the person needs to client or needs to face this again and again. This leads to intense emotions and experiencing of emotions, all the while the human is still forming its new environment and reality. This is called the work of grief by Freud, and we need to find words to be present with them. We attend to the process of grief holding emotions, and the art therapy allows to understand the person, the reality of that person. We understand the narratives of this person, and we work with metaphors. So collage techniques as of today are as helpful as ever, based on the practical research. Processing allows for reconstruction of meanings. We are able to discern and integrate the parts because the grief tears us apart, but we are able to place them back together, piece them together, and that provides us with fertile ground for a dialogue. Art therapy creates opportunities to understand individual narratives and creation of meaning. Art therapist works with meanings and metaphors. Collage is one of the directions of work that allows to retain control that grief leaves behind, and allows for different perspectives to be engaged with. A lot of the time, clients ask me, "What can I do now? What should I do? What do I do now? How do I How do I move forward?" And they say my life has been torn apart, and actually by dint of creating these collages, cutouts, placing them together, the person is able to reorganize their experience, emotions, states, feelings. The grief separates life into before and after, and those bereaved from MIA personnel, mothers, women, they cannot express enough their amount of grief. I ask myself in such cases, how do I support them? What do I do? How do I support the person who lost something the most valuable in their life? How to do no harm? How to make interventions more careful and delicate? How to not fasten or hasten the process, and how to not slow it down. And I do understand what the professionals face, grief professionals. So what I do myself, I calm myself down by saying, be present. Sometimes it's not about words, just be present and pay attention, observe, and maybe you will arrive at something. This is something about the case that we've been working for a year now with women, mothers, of this one military person. It's been over a year that we've been meeting for 2 times a week, and she couldn't accept the loss for a long time. She couldn't accept this situation in event. And as of today, we've done over 30 collages, and this is the most streamlined process of engaging her in processing. In these collages, there's a lot of pain, a lot of downtrodden uh, water, a lot of anger towards the world, how concerned it is, and not doing anything about the losing of our best of the best of our nation and community. So these collages turn very therapeutic for her. Every collage has a poignant meaning as well as cognitive meaning. We may look at our feelings right now and see how you feel, because 15 minutes is not enough to submerge ourselves into this work, but collages do help reprocess the story and find new meanings. So this is one of the uh, penultimate collages. I asked her to provide feedback on our work together, and she included all of these pains that she had, reportedly, clearly less so. But this is the truth collage that she created spontaneously. There are 4 aims for grieving: irreversibility, processing pain, accepting world without the lost, and then renewing the relationships. It's very important for me to finish my presentation by this little excerpt from Mr. Jadon's poem. People wait in the evenings, resembling snails. They sleep so sadly at the station, so deeply. The broken line of the border, like a pine branch. The road is heavy when you carry on your back, your home, and your past. Be brave. The women who stood behind, the children that don't let their hand go. We won't let the grief overcome us. We won't let hope water us. We will continue to be brave, like snails, be worthy of this journey. You're without a home, yet not without a heart. Thank you very much for listening to me and for this work that we're doing together.